Is it a he or a her?
He's here, and he's been the best guy all day, laying around, and all of a sudden he's like, no, I think it's time to play. And so he is running amok, and so we'll see if I go flying out going, no.
Hi, Christy.
So why don't I make quick introductions before we get to town hall, but it's my pleasure to introduce you all to Christy Taxton. Christy joined Health, Housing, and Homeless Services about 6 months ago, so still sort of coming in and learning all the partners, and this is a great opportunity through a town hall to really, meet individuals in one fell swoop. Christy has come to us from San Francisco, has a deep background in housing and homeless services. And so, Christy, maybe a 2-minute and then about yourself and we can roll. And hi, Lisa, it's good to see you.
Hi all, thanks so much for inviting me along for the ride tonight. Like 𝗠𝗿𝗵𝗵 said, I most recently was in San Francisco, but for the last 20 years, I have spent my career and time working in housing and working with people who've experienced homelessness. So I have a deep understanding, specifically in the Bay Area, in helping people. So I'm really excited to, now be with the County of Contra Costa. Way back in the day, I was here as a young program manager. So it's fun to be back. And I will say Brentwood houses one of my all-time favorite old colleagues. So I was like, oh, maybe she'll be here tonight. So
awesome.
I'm really pleased to be here. So thank you.
Awesome. So Captain Herbert, are we gonna?
Yeah, so we're gonna go ahead. We're recording now. So we'll get started in about 5 minutes.
Okay.
Looks like we have about 41 attendees so far.
Awesome.
So once we'll give it about another 2 minutes or so, and then we'll go ahead and we can do some quick introductions, and then I'll explain what the agenda is going to be for tonight, and then we'll go ahead and get started.
Supervisor Burgis, that is just cuteness overload.
So distracting.
Right. Oh my
We
God.
found Captain Herbert very interesting. Look at him.
Yeah.
Now he's looking.
Well, hey, I'll go. Or Supervisor Burgess, why don't you go ahead and introduce?
Hello, I'm Supervisor Diane Burgis. I'm being joined by Jeb here. Recently had some interesting times in my life, and I've decided I needed a little dog with me.
Sure.
And so Jeb is short for Jebediah, which means beloved friend. And we're still getting to know each other. And he decided that he needed to join this meeting with us. So we are going to be talking about homelessness with our county professionals and our Brentwood Police Department. And who do I turn it to? Chief Hansen?
Whoever you want.
Okay.
Let's go with Lisa. Lisa, how are you?
Hi, I'm good. I'm Lisa Thomas. I'm one of the coordinators for our Homeless Outreach Core, Coordinated Outreach Referral and Engagement Program. We're part of Contra Costa Health, Housing, and Homeless Services, and are one of the 3 access points in Contra Costa.
Awesome. And not that you need an introduction, but go ahead.
Of course I need an introduction. My name is 𝗠𝗿𝗵𝗵. I am the Deputy Director of Health, Housing, and Health. Let's try that again. I'm still getting used to the new title. So I'm the Deputy Director of the Health Services Department. And in this new role, it's my expanded role. I get the pleasure of supporting Health, Housing, and Homeless Services, as well as detention health, and really thinking about the social health needs that individuals and the most vulnerable individuals in our community need, and trying to bridge those services together. So very excited to be in my new role as Deputy Health Director and happy to be here today.
Awesome. Congratulations on that. Well deserved.
Appreciate
Chris Peart.
Yes, sir. Hopefully everyone can hear me okay.
Yeah.
I got 2 screens, so I keep looking back and forth, trying to kind of get used to this 2-screen split. But again, my name's Sergeant Peart with Brentwood, And I'm currently our homeless liaison and kind of the boots on the ground, trying to get out and engage in contact with them and work really closely with CORE. It's great working with CORE. So happy to be here, happy to answer any questions that come up.
Thank you, Sergeant Peart. Tim Herbert.
Okay, so I'm Captain Herbert with the Brentwood Police Department. I'm gonna kind of facilitate this meeting tonight, and I am in charge of support services here at the police department. So we'll go ahead and get started.
Hold on, let me introduce myself.
Okay, I'll let you introduce
Tom
yourself.
Hansen. Hey, so I've been with Brentwood for 28 years. So I've been police chief for 5 years. Excited to be here with you professionals tonight, and we are going to have a question and answer session, which I'm all for. So we'll get ready and we'll answer these questions from our perspective of how we're providing services to our homeless folks and the major challenges that we're facing. I don't think that's a secret at all. So.
Okay, so for those of you joining us, tonight's meeting will be recorded, and we're going to hear from Supervisor Burgis, and then we'll hear from Sergeant Peart. And then after that, we'll hear from Christy Taxton and Lisa Thomas related to CORE and what health, housing, and human homelessness services, that tongue ties myself, has to offer. And if you have any questions, you can feel free to type them in the question and answer or the chat. And then as the night goes on, I'll be monitoring those questions. When we get to the question and answer period, if you'll raise your hand, I'll unmute you. You can ask your question if it hasn't been answered, and then one of the panelists will answer your question for you. So we've had our introduction, so I'm going to go ahead and start with Supervisor Burgis.
Thank you. It's a pleasure to be here. I'm really glad that we're talking about this situation. Every person that becomes homeless has a unique life experience. And that means that they've had various issues in their life that have led them to this place. And because of that, each person has a unique solution to how to help them get back into housing. And we've found that keeping people housed is the best way to keep to tackle the homeless issue. But once someone becomes homeless, we have a whole bunch of programs through, and as Captain Herbert had a hard time saying, health, housing, and homeless services, we simplify it by calling H3. Sounds even like, superheroes, because they are. We have the CORE Homeless Outreach Program, and we've got Lisa Thomas on, and she'll be talking about it. I went out with her one day, and it was just so touching. These are some amazing human beings that go out and talk to people. And like I said, each situation is unique, and they're figuring out what it is that helped lead them there and what could help bring them out of being homeless. And so that can be anything from just bringing them some food and water, or helping set up an appointment to get them a driver's license, or signing up for healthcare. It's maybe a substance abuse situation. It's mental health. It can be all kinds of different things. And it's usually a combination of those things. So our CORE team is our team that goes out there and will create referrals. They'll, do all kinds of different things. And I'm just so in awe of these human beings that go out and do that work. Once they're in our, it's called the Contra Costa Coordinated Entry System, and it's designed to keep people housed. So it, making sure that they don't become homeless. If they're unsheltered, helping them. And if they, need emergency shelter or transitional housing, we can help with that. I have a puppy here that is chewing on my hand and pulling on me. So I am, anyway, with our homeless housing services, we can do all kinds of things, whether it's financial assistance or helping them with their basic needs, like getting food or laundry or showers. We do have emergency shelters, and in the last few years, we've been able to create a shelter in East County. In the 2020 PIT count, which is the place and time where we count our homeless folks, over at least a third of the homeless people in Contra Costa were from East County, over 500 people. And at that time, I think at that time, we still only had about 20 beds on this in East County, and now we have 172. Is that right? A couple more? 172. And that's because we were able to be very creative and quick, and we were able to get funding through the state to be able to purchase a motel in Pittsburgh. And if people need help, they can call 211. There's all types of prevention services. There's referrals. There's safety net services, and there's referrals to shelters and all of that. So those are the kinds of things that we are offering, and the county provides this across the county. What we have found in various cities is they have different approaches to the homelessness issue. Some people are thinking of it as a crime issue. Others are thinking of it as an economic development issue. And other people are recognizing it for the human toll and being compassionate about trying to help people and not have to live that way. And so I'm hoping that with this conversation, we can do even more, because I think Brentwood's that your slogan is "It's better in Brentwood," and I think you are the perfect laboratory to show how we can make it better in Brentwood. So those are my comments. Thank you.
Great, thank you. All right, we're going to move to Sergeant Peart, and he's going to talk about some of the current laws and that dictate what we can and can't do as a police department. So, Sergeant Peart. You're muted, Chris. There you go.
All right, am I back on?
You're back on. Go ahead.
All right. Thank you, Captain Herbert. I appreciate it. I look forward to this opportunity to explain what our department does when we approach a homeless situation. And like you said, some of the laws and legislative decisions that have come down that give us guidance on what we can and can't do. With that in mind, good evening, everyone. As Captain Herbert said, I'm Sergeant Peart. I've been with the department for 17 years. And in 2014, I was appointed as the Homeless Liaison for our department. Now, during that time, I've seen our homeless population steadily rise on our city streets, public parks, and other public areas throughout the city. It started with roughly 2 to 3 individuals to where we currently sit and fluctuate between 35 to 40 individuals out on the street. This is going to be different than the pit count, but out on the street, boots on the ground, we have roughly 35 to 40 on the street right now. What I've also seen over the past several years are laws change, and a lot of those changed for the homeless and benefit the homeless. Now, on the books right now, we have a no camping ordinance, which means you can't camp, you can't lay your head down on the street. But one of the first laws that came out that benefited the homeless was it gave them the right to rest. Now, essentially what that meant was a homeless individual who had nowhere to go and no shelter could lay their head down and rest and sleep in a public place without fear of being cited or arrested if they did so. What the courts also required is cities and department create a notice to vacate property procedures, which most cities in California established a 72-hour notice to vacate, where we go out and post and give an individual 72 hours to clean up and vacate that area. And whatever property they can't take falls on us to collect and store at the police department for 90 days. That was one of the stipulations the court recommended and required of us. Now, if they vacated that area, they fulfilled that obligation, and they could return within as little as a day, and that process has to start over again without any repercussions to the individuals. Now, the authority section we use for that is, again, still on the books. It's 647E of the California Penal Code, which is an unlawful lodging penal code. And we used that for several years. That was the standard practice for most cities within the state of California, until the landmark case of Martin v. Boise was decided in December of 2019. And for a brief overview of that case, homeless individuals set up camp and tents on city sidewalks in downtown Boise. They weren't blocking the sidewalks, but they set up camp. And the city came in, the police department came in, cited, arrested those individuals and removed them from the city sidewalk. They did this even though the premise was they had no available beds or shelters in that area. Now, the court looked at all considerations of that case and ruled in favor of the homeless, essentially saying you can't take a bed away from someone unless you give them a bed. And one of the stipulations was that bed has to be within that jurisdiction. So we couldn't say, oh, there's an available bed in Richmond or in Concord. You have to leave the city. And if you don't leave the city, we can then enforce the 647E against you. That language was put in there, we think, specifically to speak on the jurisdiction. And when we know that there's some subjectivity when it comes to that term, but we interpret that as within our city. When we talk about a jurisdiction and what we're looking into, we consider jurisdiction to mean the city of Brentwood. And we currently do not have any beds in the city of Brentwood. Therefore, we would not be able to enforce 647E of the penal code. Now, when we used to post our notice to vacates, that was the section we used. Well, in January of 2020, there was a legislative summit in Sacramento, and law enforcement leaders highly recommended and encouraged everyone to remove the 647E from their postings and use trespass. And that's where we have to look at things from a different lens. Because on private property, now that's different. Someone's private property, you can trespass and we can enforce a trespass law for someone being on private property. But public areas open to the public, i.e. your sidewalks, your city parks, and other public areas that are open to the public, some of the walkways in town, we cannot enforce trespass laws on it. You can't trespass on public property. And since we don't have beds, we can't enforce the 647E. So that may bring some cause to why you call in a call for service of an individual on the sidewalk with property. We go out, we try to build rapport and connect with them, and then ultimately leave because we don't have authority to force them to leave. Now that's not our end goal. Our end goal is to connect with our homeless population and connect them with services. And as I said earlier, we work with our county partners, and that primarily being the core team, and they do a phenomenal job responding out and contacting our homeless and connecting them with services and resources and doing what they need to do. So I hope that brings a little bit of clarity to how and what we can do when we approach a homeless situation on the street. And I look forward to some of the questions that come up later on in this broadcast. So thank you.
All right, Sergeant Peart, thank you. And now I'm going to move it to Christy Taxton and Lisa Thomas to discuss what H3 has to offer and what they do to assist our homeless population here in town.
Great.
Christy, go ahead.
Yeah, thank you so much. And while the supervisor has to go off camera a little bit, I don't have a puppy, but I have a middle schooler. And so, no, please don't. So I'm sorry, I have to pop off. We're having a bit of a night, so apologies. But thank you for the great introduction. Supervisor, she actually touched on every single thing I wanted to touch on. So that was perfect. Thank you for teeing me up. You know, we're really proud here in the county to be working with partners such as Brentwood PD. As someone who has come from San Francisco, our collaboration with the PD isn't always real simpatico, I guess you'd say. So it's been such a pleasure to be out in Contra, Costa and watch the tremendous work that our partners in PD do alongside CORE. CORE is not the only thing that H3 does. We provide a lot of services, everything from, yes, the outreach, but also our emergency shelters. We have respite, we have transitional housing, permanent supportive housing, and we're also our continuum of care lead, which means the majority of the providers that are in Contra Costa fall up under H3. And so we have a lot of avenues in which we can go out and as CORE are connecting with people and assessing, really trying to figure out what's the best place for them? What do they need? You know, not everyone needs shelter, not everyone needs permanent supportive housing, but what is it that that individual needs? And that's really the beauty of the services that CORE provides. They are truly the boots on the ground, working in partnership with folks like the police department, to really get the best service that that individual needs, really meeting people where they're at. And I mean, I could go on and on about CORE. Lisa's going to do a much better job highlighting what they do. But again, I can't begin to stress enough that this program that, quite honestly, is really still in its fledgling years, has grown so tremendously and has created such strong partnerships on the ground. That is because it is people like Lisa that are really doing the work and wanting to partner to support the most vulnerable in our communities. And so with that, no one needs to hear from me. Lisa, I'll turn it over to you so you can really highlight that partnership and the work that we do out in Brentwood.
Thank you, Christy. Like I mentioned earlier, CORE is one of the 3 access points for homeless system of care. To give you a quick overview of what our team structure is, we have a manager, Michael Callanan, 3 coordinators who oversee 13 different CORE teams. Some of our teams are dedicated to certain cities, and some of our are dedicated to certain populations. We are able to get the access from 211 by pressing option 3 to speak to our dispatch line. We have 211, our call centers that provide resources and referrals, as well as our 2 care centers, which are drop-in centers located in Richmond and Walnut Creek. We also have a service center in Concord, which is just like the care centers without case management. The types we have available in our system of care are prevention and diversion, temporary or interim housing like shelter, permanent supported housing, and other services such as housing navigation. We work along with the help of partners like Shelter Inc., Trinity Center, GRIP, Barrier Rescue Missions, Housing Solutions, and Contra Costa Crisis Center. CORE is the mobile front door for our homeless system of care. We provide ID vouchers for people to get free IDs, transportation when possible, linkage to benefits, behavioral health, direct placement into shelters, emergency supplies, and help with encampment abatements. We are a housing first model, and we work with the harm reduction. We also are connected with the Healthcare for the Homeless, who we go out with 3 days a week to different communities in different cities to bring our healthcare and mental health providers out to the people in encampments. While our dispatch line does take calls every day, we also work closely with law enforcement, local hospitals, working on discharge planning and getting people outside connected to hospitals that if they should need medical care. During the COVID situation, the services that we have offered during this pandemic is food support, health and sanitation, safety and survival supplies, training and education, and encampment displacement support, and Lincoln's to shelters and Delta Landing. We also provided testing and connections with vaccines, and we provided fire safety and risk mitigation. I can't talk today, sorry. We are the main resource to the county shelters, which is the Richmond and Concord shelters. We are also one of the main referral sources for Delta Landing, which is in Pittsburgh. And I think that's all I have. I'm going to return it back to you, Christy.
Thanks, Lisa. The last thing that I'll say, and then I'm happy to turn it back over, is that there is so much happening at the state level right now, literally happening every single day, that we're still putting our arms around and will continue. I'm sure most people have heard of the governor's new program called Care Courts, which is requiring our counties to create a mechanism in which someone will be assessed to have to go through, and it will be decided by that court what type of service they will have to get. Again, if it sounds that I'm being squishy about it and a little choppy, it's because we're still figuring it out, and there's new elements coming out day by day. This announcement just came, but there are situations, or there are going to be programs such as that are going to identify new treatment opportunities, rehab opportunities, housing opportunities for folks who are severely mentally ill or dealing with severe substance use and abuse. So all that to say is that it is such a prolific time right now of what is going on in housing and homeless, that we are here, we're dedicated to it. And we are keeping our eye on every single thing of how to bring more funding into the county to support this vulnerable population, and to really work with our other partners on the ground, such as PD, behavioral health, detention, so on and so forth, of how to best serve our population. So more to come. There's a lot more, kind of on deck right now. And that's it for us.
Great, thank you. Chief Hansen, you had something?
Yeah, Christy, I had a couple questions because I know from my community are going to have these questions.
Sure.
I was glad to see Governor Newsom came out last week with the Care Court. I think he's being very aggressive when he said he wants to have the bill passed by the end of the year.
Right.
I just hope that if you guys are in on those meetings, that we can get people like us to the table, myself included, to discuss how we're going to go forward. There's some court-ordered mental health treatment. I'm very pleased to see that we're recognizing that this is not a shelter-only problem, that this is a mental health and a drug issue in our communities. I go out and I contact my homeless folks on a regular basis, and they are addicted to drugs. And they're out there and they're refusing help, and they're victimizing people in our community. So I beg them, I tell them I'll put them in my car and I'll drive them to get help. So please don't think I'm not sensitive to their needs, but I hear from my community daily. The governor came out, said he's going to put $14 billion to this, and I would like to know how we're going to follow up and where that money's going to, and who in the county is out there trying to get these funds there. Because, and this may not be popular, but I am not a fan, and we talk about Boise versus the Martin case, that we have to set up shelter beds. And we all know that once those shelter beds are filled, our ordinances are no longer in effect, which means we could build 100, 200, 300, and the need in California right now is great. So I know these are tough questions, but you're going to get these questions from our community right now. And these are things I'm saying that, hey, why should, when the county is giving these things, and it sounds great, and I know Core and Lisa, I'm a big fan of you guys. You guys are awesome, and you guys are trying. But what we're seeing in my community of Brentwood, in the 15 square miles that I'm responsible for, and when I'm out there trying to get help to these folks and they won't get help, that's why I'm thrilled to hear at least we're seeing now that, because I pitched to a senator recently that we are closing Susanville prison with 2,900 beds, and we could start setting models up of mental health treatment centers, I mean, we don't need 100 beds. We need 5,000 beds in Northern California. We need 5,000 beds in Central, and we need court-ordered help. We need these folks out here. What we're doing to them is cruel, and we will all agree with that. That if I could go out right now, we could get court-ordered help. So excuse me if I'm coming across aggressive, but believe me, this takes up 20% of my week all the time with my staff. And I am frustrated. I am frustrated. We're all frustrated.
We're all frustrated. And I'll tell you, the thing that's the county government is that we are given mandated tasks to do. And never are we given enough money to do it properly. And that's where the problem is. And so Contra Costa County has been trying to leverage our money and to develop relationships with the governor, with housing, with all of these folks. And that's why we've been able to bring more money into Contra Costa than in some other counties. And the problem is, you know, it kind of just, the problem gets shuffled around. And so what we're doing is the best we can with the money that we have, with the requirements that we're supposed to do. And that's not an excuse. It's really just what it is. And so what we're trying to do, I mean, there's been times when we were trying to get, we try to get funding and we need to have the support. And for a while, some folks weren't really even buying into this being an issue, even in Brentwood. And so I'm glad that we're finally putting a light on it and saying, this is a problem. You know, there's one of the solutions, and I know it's not the solution, but the city of Antioch actually, like, I don't know, Christy or 𝗠𝗿𝗵𝗵, I don't know if you want to talk about what happened as far as we have the shelter, and there's certain numbers of beds that are reserved for the city of Antioch for their homeless situation. I don't know if that's now is the even time to talk about it, but there are some other options that we can look at.
Yeah. Thank you, Supervisor Burgis. Christy, if you don't mind, I'll jump into sort of the relationship that we always have strived to develop in with our cities. One of which is what Supervisor Burgis mentioned, in that we are really excited and happy to partner with our cities to support those individuals who are already utilizing services. So, for instance, in Delta Landing, in looking at our data over the past year, we were operating that facility as a COVID response. 30% of those residents in that facility at any time were the city of Antioch. And my apologies, but I don't have the city of Brentwood data on hand, but I most certainly can make sure that we get that. But what we do know is that in order to keep those additional 174, beds or rooms that serve about 200 individuals, in order for us to keep that resource, it's about $3 million a year to keep that resource. And so we have it's really important to create the partnerships with cities like Antioch, Brentwood, Pittsburgh, you name it, to support the ongoing operations. So the city of Antioch has committed to supporting for the next year 15 beds, right? Which is fantastic. And we have, we serve on average about 60 individuals at any point in time in that facility. So they are supporting, about 15 of those beds. We would love to make sure that we're partnering with the city of Pittsburgh, the city of Oakley, the city of Brentwood, so that we can ensure that individuals who are excited actually to come off the street and actually receive shelter in a very different way than we've ever had shelter in our community before. When they want to come in, we want to make sure that the resource is there. So, absolutely want to continue to make sure we're partnering. And yes, those are things that we look forward to as far as opportunities to partner with the city to say, we absolutely can make sure that through your funding, that there are beds available for City of Brentwood residents. Did that answer your question?
Yes, thank you, 𝗠𝗿𝗵𝗵. But I'm very frustrated, and I hear about those beds, and I'm not I know it's shelter, but I think this is a multi-pronged approach that we just seem to always think. And I'm listening to the governor and his Roar Back Better 2-hour conference, and he's talking a lot about getting 55 shelters. We're missing some big components.
No, I'm 100% with you. And shelter is not the answer. It's not the only answer. There's a full continuum. And, in Contra Costa, we built that continuum. But let's be honest, you and I have had these conversations before. it's still not enough. And these opportunities that are coming down from the state, like care courts and things of that nature, those things are going to be great opportunities, again, to support what we already know works, the continuum that already needs to be in place. And at the end of the day, we still need more. And we need to think about how prevention fits into this and where those resources are going. Because at the end of the day, when we're sitting and relying on the safety net, the crisis response system, it's already too late. We're already behind when we're talking about waiting for the crisis response system to solve the problem. So we do need to move upstream. Things like, care courts, we're still, verdict's still out. We don't know. And we are hopeful that that will be, again, a good part of the solution. One of the other things, behavioral health housing, that's fantastic. We want to make sure those beds get developed because it is needed. Housing that is for individuals who are severely mentally ill or who are duly diagnosed and have a substance use disorder. We need those beds in our community. And we also, let's be honest, when it comes to siting those facilities, we are still going to have those same issues around where do we appropriately site those sort of programs. It's going to really, I think, we're going to need to rely not only our county partners, but our city partners to ensure that when those dollars are available and when in partnership we go from the county with the city to the state and ask for those dollars and they're granted, that we can in fact make sure that we can make good on that award and build the housing that is needed where it's needed. So I think there's a lot of work that we have started to do in Contra Costa that's going to be really important that we continue in partnership with PD, with our social services department, with our public defender's office. We have a lot of not just boots on the ground work like Lisa does, that's going to be important, but really, again, the upstream and the political will, which is why I'm so glad to see Supervisor Burgis right here to really support, who's always supported and said, we need this. How do we get this done?
And I'm curious, I know Chief Hansen, you're talking about, law enforcement, but I don't know what the city of Brentwood does. I know that they had funding a couple of years ago when I was talking to them about keeping people housed. So I don't know what kind of housing assistance they have. I know that the other thing is that, some people become homeless from other situations, and then substance abuse and mental health becomes a problem worse once they get on the street. So the prevention is the big thing. What we're also working on is the Regional Impact Committee, and that is something that we're working on to work on prevention, create programs that will support people when they're in transitional housing, and then finding permanent affordable housing. So we're not looking at whack-a-mole trying to help it and do this. We're looking at a whole system that prevents it and then gets people housed and keeps them housed. But it's a system that is not one county, not one city. We're working on a regional issue. And if you go anywhere in the country, you will see homelessness is not unique to us. And so we're really trying to figure out how to do the solution with the limited resources that we have. And I'm really impressed with what LaVonna and Christy have been doing, and that is getting additional funding for the county so we can do this.
Supervisor Burgis and LaVonna, please do not take this as me. I want to have a candid conversation today. Okay, and this isn't something that I just woke up this morning and started talking about. So please feel through my frustration, but I am talking through my community too. The fact of the matter is we're not talking $14 million. We are talking $14 billion that the governor has put aside to deal with this. My citizens pay taxes to the county to provide these. Now they're never going to be enough money, but how can I, as a police chief and as a member of city staff, sit by and tell my community we're doing this or we're doing that when there isn't a model out there right now that works, because we are missing prongs to this approach. And I am never going to support us spending one penny for shelter until we have something set up. And it is that we have not gotten people that are boots on the ground in a room with clinicians, with doctors, with Levana, with judges, with public defenders to sit down and come up with a model that says, I'm sorry, but you can no longer take care of yourself. I have 3 people in Brentwood right now that are mentally insane. They don't belong on the street. They belong in a facility. And I'm sorry, but my thing, and I've given this a thought, and I've sat and done my work up on this, but there needs to be, we all need to get in a room, and we say this in one jurisdiction, they're doing this, and this, well, we haven't, you give me a model that works. We need to get people in a room with $14 billion to come up with plans that say, if you fit this criteria, I'm sorry, you can't be on the street until we get you some mental health and we get you off whatever drugs you're doing, because you are not healthy. You're going to die out there. We need to get you off the street. And you guys know that. You feel this frustration. But I talk to Chris every morning when he goes out. And I'm just venting right now, but this is what I'm hearing from my community, and this is a study. So whatever we can do, you guys are awesome. Your heart, you're trying to help, but we're missing some big components in this. And the governor needs to step up, and he did step up a little bit last week with this. I was thrilled to see that. But he's saying, let's get it done by the end of the year. There's so much work to do, and please get me in a room. I'll do it for free.
So Hampton, what do you think we're not doing as a county that somebody else is doing? Because I feel like
no, I'm not criticizing you. I'm not criticizing you. There's not a model out there. There's money. It's just, you want my honest opinion, it's going to other some organizations out there are taking big money, and we're not seeing any results. When I take an OTS, Office of Traffic Safety grant, I have to turn this in December, saying how many crashes were decreased, how many tickets I wrote, and what I did with that $85,000. I've asked, where's this money being spent? I've followed a lot of nonprofits, and I'm not down on nonprofits, because there's a lot of great work out there being done for our homeless folks. But I followed some money, and I'm wondering, where's that money? And we're not just talking millions, but that's what I'm saying is, Supervisor Burgis, we're going to need our leadership to step up and get up to the governor's office and say, look, we have the money. I used to think this wasn't possible. We have the money.
we need our assembly members, our senators, and our congressmen, because like I said, with the current what the county does is we are given a mandate of doing particular things, and they decide how much they're going to give us to do it. And so what I'm saying is we're taking what we've got, and then we're creating more money, and we're doing the best I can. And like I said, until just less than 2.5 years ago, there were no shelter beds in East Contra Costa, and now
please don't think I'm criticizing you, because I'm not.
Well, I'm looking at the comments, and I'm like, hey,
I'm not looking.
We are trying really hard, and I care what these folks. No. I care, and we are. I've got these amazing people that are trying to do the best they can, and I hear what you're saying, Chief Hansen, because I think what you're saying is what a lot of people feel, including us. But we've decided to take jobs, particularly Lavana and Lisa and Christy, and they're saying, I want to do a difference. And they're doing it with the resources that they're given. And I'm trying to get more resources for them. So I think what we all agree on is that we need to be looking to our next assembly member and our senator, and we need to be pushing even more. And I would love to go to Sacramento with you and go ask for more.
I think you can count on myself and Christy joining you in that. I think there's, some of the things that we struggle with all the time, and we are at the table with our state partners. I am in at least 2 meetings a week with our state partners to talk about what's needed. And as much frustration as you're showing, I promise you it's 20 times over for my team when we hear things like, the community's hearing that the governor is putting $14 billion. Well, actually, that's not true. Actually, more than what 80% was already budgeted in the last budget. It's not new dollars, right? We also, what isn't showing or wasn't showing up is that there is not an opportunity for us to actually, we have to compete, right? There aren't allocations necessarily for that. And as an example, when you talk about the state providing dollars, it's fantastic that they do that, but oftentimes it's one-time capital projects, and we have to figure out how to keep operating those operations going. It is small incremental change. I wish we could do it wholesale, and that is most certainly what we've been advocating for the last several years, is how do we create sweeping change so that we can make sure that people are getting housed quickly, that they are getting the housing that they are going to stay in, right? Because there's no point in building a whole bunch of shelters where nobody wants to go. It's a waste of money, right? How do we get those dollars into our system? And not only that, one of the things that I want to share is that, as I said earlier, we do really need to think about partnerships with the cities, because as a prime example, we had put out the homeless encampment resolution grant. There's a lot of frustration about encampments, and I just want to acknowledge that. A lot of frustration about encampments. The state dedicated dollars for homeless resolution grants to counties and cities. The county had put out to each and every one of our partners to say, if you are interested in this grant and partnering with this grant, please let us know. And it's those missed opportunities sometimes when we are trying to make sure that all the cities know about what's available. When those missed opportunities go, then we have to figure out how to bring other potential dollars in to try to support what an opportunity we perhaps missed. The great news and the great thing for Contra Costa, which doesn't help Brentwood, is that the city of Richmond said, we will partner with the county on this. And they just received $4.8 million to really start addressing their encampments in the city of Richmond. It's those type of partnerships that we want to make sure that we're doing with the city of Brentwood as well. So we want to make sure that we're making sure that the information is out there, it's available, that we can try to do our best to apply and then be successful. We do know what works. We really do. It is about scaling.
And I've got to say, I'm really glad we're talking about this with Brentwood, because I mean, 3-4 years ago, I don't remember how long it was, but I came to Brentwood asking for a resolution declaring a shelter crisis. There was nothing that came with that except helping us get the funding so that we could build a shelter, because we didn't have the money to build the shelter in East County. And I couldn't get the Brentwood City Council to approve that.
And I didn't support that, Supervisor, for a variety of reasons.
I understand, but the thing is the problem's gotten worse, and we've been.
But that was one-time money too, and the thing is, you know what happens with one-time money? We set services up, and then the one-time money's gone. You guys deal with it all the time, and now we're stuck with this, and my citizens are on. I want to make one point. Is I'm dealing with 35 people, and any of you that want to come out and go, right? And again, you guys, I hope, I just get passionate, so I'm not yelling. I get accused that I yell. I'm not doing that. I'm just passionate about this. I'm telling you that 90% of my homeless are addicted to methamphetamine right now. And I can tell you that you guys are awesome at providing services for people that want the service. That's all I'm saying. You won't see a mom out there. I heard we had somebody living in a car. No, that's not going to happen. We're going to get out there. If mom or a veteran that's suffering from mental health or someone that wants it, you guys are awesome at doing that.
What do you want? What is your goal here? Because I feel like what you're saying is, you're frustrated, and and it's kind of pointed at us, and we're saying, well, we're frustrated too. Well, I think this should say, hey, this is a great partnership, because I think we have a lot of common goals here.
Well, what I'm saying is right now is, if you can answer this, why would, and this is going to sound cruel, and I'm not trying to be cruel about this, but why would I support building a homeless shelter with people that are addicted to drugs and are suffering from mental health crisis and that are mentally ill out on the street right now, why do I want to house them in my community when Governor Newsom is saying, and Levon, I know that's a multi-year, for the 14 million was multi-year, was saying that he wants to build 55,000 shelters here. My frustration is not with you, it's with Governor Newsom in the state of California, is why would I want to build a shelter in Brentwood to house my homeless who are mostly addicted to methamphetamine when there's nothing set up to help these folks that are addicted to methamphetamine? There's no court set up, there's no law set up that says that we mandate them into treatment. That we need to start there. Why should my community be on the hook for that? When there's 14 billion, I used to think it was cost prohibitive. It's not. We can set things up, but the governor's cut me out and people like me out from the table in my officer, Chris Peart, who is on the street at 4 o'clock in the morning dealing with these issues. So Supervisor Burgis, I'm sorry if it sounds like I'm really not. I'm a big supporter of you and your staff. And
I'm a big
I'm
supporter of
sorry.
you and your staff too. I appreciate all you do. And you know what? I think this is healthy because this shows really what is the frustration is. Like, we're all here. You didn't take this job to be able to look at folks and say, I can't help you. You took this job to protect people and to help people.
I
And
love
so
my
did all-
community. I love my
Yeah.
homeless.
And
And
so
I
did
want to
all-
go to Sacramento with you and our assembly
Let's do
people
it.
in Levon, and
Let's do it.
let's get
Yeah.
something going and get the money spent where it needs to be spent.
I
And not on the
agree.
backs of my community who are out there trying to keep a nice community. I'm not saying that, but please tell me, if someone can tell me why I would support a shelter here, then bring it forward.
Well, that particular issue was not asking you to have a shelter in Brentwood. It was so that we could build a shelter in Antioch, actually, because that's where they wanted it. But that was just giving us a grant to be able to build a shelter, that particular issue. But I'm not saying, I think you're talking about what the governor is saying. So
Yes.
yeah,
My
but
frustrations
we're
with
not trying
Governor
to build,
Newsom, 100%.
we're not
If I-
trying to build a
yeah.
shelter in Brentwood.
No, not at all. And if I may also chime in here, I think you really did hit the nail on the head and started to maybe peel back some of the onion here in that we are having conversations around homelessness, which is a housing issue. But that is not the only issue that many of our individuals who are on the street are dealing with. And so when we talk about severe mental illness and we talk about substance use, there are no legal means for us to take someone involuntarily, right, and place them into treatment. And I think that's the frustration that we all feel, because at the end of the day, you are 100% right. We can build the housing all day long. It is slow. It is, and that we can wrap all the services, but people have to be willing to take those services, want to get treatment and receive the services in order to, be the best selves that they see for themselves. But at the end of the day, we don't have, right? We only have carrots. We don't have sticks. That's not our role, right? We don't have the sticks. So I really appreciate this conversation, because what I think you did was really just begin to illustrate sort of homelessness is not it's not about SMI and substance use. Like, homelessness is a housing issue, but there are complicated, right, a confluence of things that oftentimes complicates and reasons why people are outside and won't come inside. And we don't have those. There aren't any laws. There's a little there's an opportunity through assisted outpatient treatment where we can legally take someone to courts and have them participate in treatment. But again, those things, Laura's Law, those things are small sort of tests of change and pilots. In Contra, I think there's 75, right, who are in that program. And so even care courts, and I really want to emphasize this, even though care courts are on their way, we are excited about what they can provide, it is still a civil proceeding. And what I understand is that they still won't be able to involuntarily mandate medications. So it is one of those things where I I think it will be helpful for those individuals for us to get out early and identify individuals who may need these supports, who might be open to taking meds, who want to avoid and be diverted from the criminal justice system. I think it's a great strategy there, and it won't, I think, fulfill what I hear some of the community wants, which is force them into treatment. Make sure they change their behavior. Do your best to do that. And we in homeless services don't have the tools in order to do that.
And I've got to say, you know, for those folks that are mentally ill or addicted or both, there are family members that are struggling. They want to take care of their family members. They're trying to get them help, and they have not been able to get them help. And so I'll tell you, Contra Costa County Board of Supervisors is investing in mental health crisis teams, early childhood and youth mental health, where we are investing some of our Measure X tax dollars to work on kind of that prevention. But the problem, like 𝗠𝗿𝗵𝗵 said, is in the 80s, there were some changes to the laws that said you cannot force people to be in a mental hospital. You cannot force people, you know, to be in these institutions. And so some of those people shouldn't have been in those institutions, but there's some people that are now too dangerous, scary, or undependable to live with their family members or amongst people that they can get along with. And so that's where what you've got. And so we not only need to do the housing, but we are working on the mental health and the substance abuse as well.
Can I say something real quick? CORE works really closely with the Brentwood Police Department, and we try to create a rapport with your homeless population and try to convince them sometimes to go into shelter, as well as detox, and as well as, you know, possibly when we bring the health team out there, engaging with the mental health providers that are there. We do try to continue to do that, you know, as often as we can, to try to get them to trust us a lot more, to either get them to agree to go to detox. Sometimes they go to the detox, sometimes they leave, but we continue to offer our services to, you know, sooner or later, you know, there's going to be a yes, you know, and then we try to move on from there. It's not like we can force them, but we can keep coming back to them to assure them that this is something that's going to be better for them.
Yeah,
if that makes sense.
It does, Lisa. And I want to say, Chief Hansen, I share all your frustration. I've been doing it for 20 years. I know you have as well. We all live in, you know, I don't live in Brentwood. I live in my own community and facing this too. And it's the work that I've dedicated my life to. I think I will say, you know, I've been in this role now for 6 months in Contra Costa. And the things that I've seen happen, I've been kind of reading the comments in the chat of, well, that's there. What about Brentwood? I think one of the things that we might want to look at and start thinking about of, we can have all the town halls and we can vent because A, it's important. We're all frustrated and to get that out, but then what next? You know, the fact that you have, you know, you have the sergeant here who's a homeless liaison on your force, that's a really big deal. A lot of police departments don't have that. And so A, I think that's taking the step in a right direction. But B, it's also for the community to engage your city council. County is one entity, but what is the city wanting to do? And what we have seen in engaging other city councils, I saw someone mention that Antioch bought a small hotel. They did that through the city. And that's a really big deal, you know, and what can we do to partner? There's ad hoc homeless committees that are being born out of city councils that we're happy to partner with. There are additional homeless liaison managers that they're hiring outside of PD. So I think there's other strategies. Yes, other communities are doing, but what are they doing that Brentwood might want to adopt? County can't tell you to adopt those things, but we sure as well will be able to step in and support and be thought partners with you all. We don't have all the answers. I wish I had a magic wand. I tell people every single day, I wish I had a magic wand or there was just one solution that cured it all. And as you know, Chief, there's not. You see it on the street every single day. I get that you are, talking to your community folks and people are frustrated. I've never seen the level of frustration as high as it is everywhere. And Brentwood is just the same. And I share that. And I have again been reading, this is not a platitude. I share that. And we are struggling with it and trying to figure out, when the governor comes out and says $14 billion, we just kind of sit there and go, oh no. Because what people hear is there's $14 billion, but it's all been earmarked. It's already been promised out, but he's saying it in terms of, we have all these new things to do. So and I'm not down on the governor. I mean, I think he's trying to do the best he can as well, but I'm trying to figure out what can I do to partner with you on the ground tomorrow to start figuring out what are the solutions? What can we do in the town of Brentwood to try to begin to get at this? And that's my commitment to you all. We have CORE out there. That's a tremendous, huge first step that other communities haven't taken, but now what? And so I'm happy to walk away from this and continue to the dialogue and to thought partner, what are those solutions, and engage the community around this. Happy to do that.
Christy. Well, Christy, I'm not a fan of the governor.
That's fine.
I've reached out to him, and we're Supervisor, I think it's time that we get our new assembly person and we take some bold steps, because they need to hear this. They need to be out in these homeless encampments, and they need to see these folks and the mental health that they're going through. You guys are trying to house them and get them help, but it's beyond this. I can't fix this, okay? We don't have the money. You can't fix this. This is a statewide issue that needs immediate help right now. And those prongs I'm telling you about need to be put in place, and they need to put in place fast, because shelter is not going to fix this. And if I bring them out and show them some of my folks and say, do we need to get the courts involved in this? Do we need to pass legislation that mandates this poor soul right here, who doesn't even know where he's at right now, to get him into some treatment right now? That's what we need to do. We can keep throwing money at this all day long, but and I'm confident in the research I've done, in the steps that we do. Unfortunately, we're not brought to the table, and people like you, experts like you, and doctors and clinicians and judges and public defenders and DAs, we need to get in a room. We can do this.
Yeah, the frustration is people are like, well, why can't you force them? The same reason why you can't force them. I can't force them, and you would have more of a authority to do that than me. Yeah. And that's what we're limited. That's why we're handcuffed from this. And so
And I understand that's a big deal, right? Taking people's liberties away, and that's a bold move. That's bold legislation, right?
Right.
I mean, when you're talking about civil liberties and taking people's rights away, we all respect that. So there's got to be serious.
I'll just say it again. There are a lot of people out on the street that are loved by somebody, and they're also feeling very ineffective and unable to help them, and desperate because they don't know if they're going to get a phone call because someone's overdosed or hurt somebody or been arrested. And I'll tell you, full disclosure, I have a brother that is mentally ill. And when he got arrested, he was able to get assistance. And eventually we were able to get him into a program. It's hard and it's scary and it's painful. And for every person out there, there is a really sad story, and we need to remember these are human beings that may not have been addicted before they even got homeless. They may not have had severe mental illness before they became homeless. There are a lot of things that we can do to probably try to help people stay housed, and then we need to go to Sacramento and really push it. And I'm anytime, Chief.
All right, thank you. So we'll get started with some of the questions. One of the questions I did want to get answered was, why is there not a drop-in center in East County? Is that something either Levon or Christy can answer? And then I'll move to the people who have their hands raised.
Sure, I can start, and Christy, please, chime in. There has been no change. I think I would, so let me back up. The last point in time count we did it was in 2020. That was 2 months before the pandemic hit. Since that time, I think probably everyone who's listening knows that there was a bit of a moratorium and a COVID response. That was a moratorium on moving people off the streets, right? Moving them into congregate living situations where the virus could spread. And in addition, there were a number of individuals who lost their jobs, became homeless, sleeping in their vehicles and in RVs. And so over the last couple of years, we most certainly have seen growth in visible homelessness that's throughout Contra Costa. We have just completed our point in time count, so we don't have we did not conduct a point in time count in 2021. But we did conduct a point in time count about 3 weeks ago. It feels like time's flown. So about 3 weeks ago, we completed our last point in time count. We hope to have those numbers, Christy, in the next, 6 to 8 weeks? Is that what we're looking at? Okay.
The question was, do we have a drop-in center in East County?
So we do not have a drop-in center in East County at this time. And some of the thinking around that. So initially, you may recall again, prior to the pandemic, we were working really hard to develop a drop-in center and shelter in Antioch. And we're doing our best to pull all the funding together to do that. And then we needed to respond to COVID. And at the same time, HomeKey, an opportunity to purchase hotels that were already serving individuals was presented. You may remember that the governor came down to Pittsburgh, really made the announcement from the Motel 6, in which that was currently being used for the Room Key program, and said that we're going to provide home key dollars so that individuals can develop permanent housing or permanently install their interim housing opportunities. And at that time, it was really clear, instead of a 6 and 7 year build out to build something from scratch, that it was an opportunity to provide immediate relief and assistance and bring that to East Contra Costa County by getting 174 rooms, which also includes a wellness clinic on site, and which with behavioral health, mental health clinicians on site, as well as nurses and physicians to provide services the individuals may need. So we most certainly took advantage of opportunities that were presented to us, and now we are back to thinking about what else do we need. And a drop-in center, we are absolutely hearing we still need that. And we are looking to determine how we can bring that to East Contra Costa County. But I just want to, in full transparency, we needed to take advantage of the opportunity that was presented to us to build and receive and get housing that we needed very quickly in East Contra Costa County. And so wanted to make sure that we took advantage of the new Delta Landing program.
Great. All right. Carolina Villaseca, I'm going to unmute you so you can ask your question. Go ahead.
Thank you. I actually have a multi-pronged question, since this is a multi-pronged problem. I've sat here listening, and so I see that we need to do at least 3 things. Number one, we need legislation to help police and first responders get addicted homeless people who are no longer able to help themselves into treatment. So how do we do that? Who do we contact? I'm happy to go to Sacramento with Tom Hansen and Supervisor Burgis, but who's in charge of that in Sacramento? Who funds that? Are there programs in Sacramento that we can tap into? Are there other cities that have done this successfully? How do we do that? Number 2, there was a mention of needing something from City Council from the city of Brentwood. So what is needed? What is required? I'm a frequent flyer at the City Council meetings. I'd be happy to bring forward for an agenda item on what it is that you need. We just need to know what it is and if it's something that City Council can do. And then number 3, there's Measure X funding that the county's handling and state funding that the state is handling. And so from what I understand is who do we go to in Sacramento to get the programs funded that we need? So when we go, it's clear, who do we talk to? Is, you know, it seems like we have to do a lot of talking with a lot of different politicians, which is fine. We can corral them in the hallways if we need to, but we need to have a plan to make sure that when we go, we can be succinct and effective and say, this is what we need. This is the funding it's going to take. How do we get that? So those are my 3 questions.
Well, the first one, as far as forcing people, that
Not
is,
forcing.
well, I mean, that's basically what their needs, that's what would be required. And that would need to go to the Supreme Court, I believe. The second one is the city council, and that was a different city council at that time. And I think that now we have a city council that is probably more open. And I'm sure Chief Hansen also has some ideas on that. And the third one was, where do you get the funding? I remembered those 3 questions. That's great. The way to get funding is to go to the state capitol and to the to Washington, D.C., to the folks, you know, that represent us and Sacramento and Washington, D.C., and to make the case. And when you can make the case, you have to be able to show what you're going to do with it and how you're going to do it. And, you know, that's how you do it. And so you start with your local representative. And so the nice thing with Contra Costa is we have several state assembly members and a couple senators, I believe. We also have a couple congressmen representing Contra Costa. So we have a group of folks that represent us on the state and federal level that are open. And if people make enough of a case for it, they will fight for that money. You guys can add if you want.
I think you hit that, Supervisor.
Okay, Sean, I'm going to unmute you. Go ahead and ask your question, Sean.
Okay, thank you, Captain. First of all, I'd like to just make a statement that aside from the Brentwood PD gentlemen that have joined us this evening, and Lisa, it seems like 3 of you don't seem to take this quite as seriously based off of your jovial attitude, your chuckling and your laughing. I don't think that having that kind of an attitude is going to get us anywhere. I appreciate the chief's elevated attitude on this, trying to impress upon you that this is a real problem. My question to all 3 of you, LaVonna, Supervisor Burgis, and Christy, is what have you done? What have you actually done to affect a change here in Brentwood? What are your accomplishments so far here in Brentwood? I'd like to hear that. And I'd also like to know what exactly you think you can do given the confines of the laws, and not give me a whole bunch of roundabout answers and just talking points and stuff. I would like to hear what your real actions are going to be. I walk the streets of Brentwood every single night. I speak to officers quite often from the Brentwood PD. We walk by one major encampment every single night, and those people are most definitely on methamphetamine. They are not there because they cannot afford the rent. So what are you doing about a daily interaction with them? How many of the 3 of you have actually gone there and asked them their names, asked them where they're from, asked them how long they've been on the streets, and asked them a very pointed question of what is their drug of choice? What have you done with regards to those things? Thank you, Chief.
Sean, I'd like to jump in here. You know, I know you're frustrated. Look, it's my job and my officer's job to go out and contact our homeless folks in our town. And I know the frustration. You're just as frustrated as I, but I want to let you know, I've been working with LaVonna for a lot of years now, and they do work within their confinement of what they have. I think our frustration, and the caller before, Ms. Vacate, look, we need to get together if we're going to make real change. And this is a state and federal problem, okay? This county these people are good people here. They want the best for our community at all. I know it. I have conversations with them. So I know you think they're nonchalant. They're not being nonchalant. I have had talks with every one of them except for Chris. I've talked to the supervisor in 𝗠𝗿𝗵 for years. They don't have a lackadaisical attitude. They want to help, but they are in confined. Now, let's talk about going forward tonight. And I believe Supervisor Burgis, she will go forward and we will get with our new assembly person. And if we need to take it to Washington, but I think we are clear that we need to take bold, drastic measures. I didn't mean to jump in here, but I want to know, I want people to know that you guys take this very serious and that you do care about the people in Brentwood. So we're working together and let's come up with a plan. There is a lot of work to do and it can seem overwhelming, but I think we can do this.
Thanks, Chief Hansen. And I will say, as the county supervisor, as the person that's the elected person, I will say I am not taking this lackadaisical. I will say that if you see a smile or you see someone, you got to realize these are people. I'm going to speak for the folks that work for the county. These are human beings that go home every day trying to figure out how to solve this problem. And that's what they do. And if we look like we're smiling, it might be from nerves, it might be from trying to think. And so I'm not going to do a lot of defending, but I will say that I have worked with Chief Hansen. We talk to our county folks, we work with our core group, and we do get people off the street. It's not fast enough, it's not enough people, but we are working to make this a better situation for everybody. So.
Thank you. So I'm going to go to Rod. I'm going to allow you to speak, Rod. Go ahead and unmute yourself, Rod.
Yes, thank you. First of all, I'm a little bit disappointed in the content of this meeting. I came here tonight as a citizen looking for an idea of what the homeless situation is and what I can do to help, and what is needed from me and what's needed from my community. What I'm hearing is several officials at various levels in various stations getting together to discuss a problem, and it's clear it's been discussed amongst at least some of you before. What I'm not hearing is a single consolidated vision for what needs to be done. It sounds like you don't agree among yourselves what precisely needs to be done. And if we don't have that, if we don't have our public leaders to come together, come up with a plan, ask us to get behind the plan. Now, I have heard, amongst all the discussion, I've heard some conditions that we have to deal with. First of all, the federal condition that won't allow us. People keep asking, well, why don't we round these people up? Well, you can't. And I mean, I've heard that loud and clear. You would have problems with the Supreme Court. The federal law will not allow you, and the courts will not allow you to do that. You could take people off the street. Can't do that in Brentwood because we don't have a bed here to offer them. So that's a constraint. So I'm hearing a lot of constraints. I'm hearing a lot of disagreements, and I'm hearing some frustrations amongst yourselves with each other. What I'm not hearing is one single focused plan that this community can get behind and help you push at the state. I don't know what you want me to do as a citizen. I don't know what Supervisor Burgis expects us to do. I don't know what Tom Hansen, the Chief of Police, expects us to do. I don't know what 𝗠𝗿𝗵𝗵 expects us to do, because it seems like you all have different expectations, but the problem is the same for all of you. It's the same problem we all have. There needs to be, first, a vision. And the group that you have assembled here tonight seems to know a lot about it. And I would really encourage you to work together, develop a solution, and then go press that solution. But you have, I mean, you have obviously a congenial relationship, but you don't have a common vision. And without that, you're not going to solve anything. And I'm telling you right now, you're not going to solve drug addiction. Drug addiction is not something that any of you is going to solve. People that are taking drugs it's like the hardest thing to solve drug addiction. I mean, what's the success rate for Alcoholics Anonymous or Narcotics Anonymous? It's like 20%. You don't solve drug addiction, but you can offer people help. And, but there's constraints. You've got funding constraints, you've got legal constraints, but what you don't have is a solid, straightforward idea what has to be done that you can all agree on, then come to the public and tell us. I really appreciate the spirit in which this town hall was offered tonight, but at the end of the day, it's kind of a failure when you're leaving people asking the same questions you're not really ready to answer. The answer to why don't you force people off the street is because you cannot. It's a violation of federal law. The Supreme Court won't let you. It's just as simple as that. You just can't. So you have to do something else. And I understand, the public in general is often not aware of what all the basic constraints are. But what you need to be able to do is lay out the constraints very clearly for people, because obviously people aren't hearing you. I still see the questions in the chat. And you also need to be able to say, but this is what we can do. This is what we must do, because the situation as it is now is untenable, right? We have to do something. It's distressing to me. I'm a human being. I give a damn about people living on the street. I see people living on the street, and I know that there are people for many reasons living on the street, but it seems like what we're seeing is there's a certain intractable population that might be drug addicts, but there's other people that are living on the street that are not drug addicts, and we're not addressing that. So it's a multi-pronged problem. It's a wildly complicated problem. But until we have public officials that can work together, can come to a common vision, can come up with something that the public can understand and get behind, you're going to keep having that problem. Somebody else said, we should all just get together and go do something at the state. But then you look at some of the hateful comments in the chat, we're not together as a community. We have different visions, but we need a common vision. We need to be able to say, okay, this is the problem, these are the parameters, and this is what we're going to do. And I'm not a government person, I'm a private sector person, and all I can tell you is how I operate at work. And this is what we do. We do not leave problems sit. We go and solve them, because we can't survive if we don't. And that's what I expect you to do. Thank you for your time.
Thank you, Rod.
Yeah, I would just like to add, we do work together. We do work together very well. I think that was evident when Sergeant Peart was talking about working with CORE in the county health. If I had the answer to this problem, I wouldn't be standing here. I'd be signing books at a book event. This is the most complex issue that I've ever dealt with in my career. And yeah, we do. These people you see on the screen, we don't. This isn't our only the ones at the top. This isn't our only job. So this is a great start. We were talking about getting together. It's such a complex issue. And in the 70s, we did have hospitals that treated folks. I think this is something that we can do. But this is the most complex job, and there isn't a model out there that works. I'm sorry. I've studied a lot of these models, and some of these models will work in other communities, won't work in Brentwood. So it's a complex issue. I could pick up the phone and have a conversation with LaVonna anytime. I don't know if I showed up today giving marching orders to our public on what we needed. I wanted to talk in a town hall and get some information. I wasn't prepared to solve the problem tonight. So
Yeah,
this was kind of a start.
this was a discussion, and I think it's healthy to, people want to know how things get solved. Well, this is us talking about it, and well, why aren't you doing this, and why can't we do that? And the questions that are being asked by the community is great, because people don't realize, the police can't just say, you need to go into a mental hospital. They can't, they can't say go into rehab. They can't just say move along. They have constraints. The county can't do certain things either. And so I like that this is kind of messy and isn't, necessarily giving people the solution. It's because we are human beings trying to solve this problem. So yeah, this was a discussion, and I'm sorry that it feels disappointing, but it's real. It's not staged. This is what I see from all kinds of different people trying to solve all kinds of problems, coming together. And interestingly enough, not enough people actually talk to each other that are affected by different things. So it is, I really appreciate those comments that the last caller brought in. And this is a discussion.
Okay, I'll go to Greg Robinson. Go ahead, Greg.
Can you guys hear me?
Yes, we can. Go ahead.
Cool. Well, thank you all for taking your time in this evening to meet with us. And I agree with you all. And I do believe that we all work together, and that's the only way we're going to get things done is if we all work together. So, and I've known Tommy and several other people on this call for many, many years. So just wanted to kind of reiterate a couple of things that you guys said. And like I said, I don't think when we have is we have to talk about how we got here. We know that, and we say it's about the mental health. We know that, like I said, it was back in the 80s when Reagan changed the laws. And now we have this situation that nobody anticipated, 20, 30 years ago. And to the compassion part, of course, we are so compassionate to all human beings, and we want to take care of these people and help them. So my thing is that I agree with Tom, and I think it's about bold and drastic moves. And my thing is I'm the guy that's, like everybody's saying, let's just throw some ideas out there on the whiteboard, whether you guys do anything with them. We don't have to respond to them, but just some of the things that I would suggest that if we're not doing, we should do. And so we can take that first step to make change. The first thing I wrote down is that we talked about the homeless people, and we're absolutely right. There are some people that got into a bad situation and they're homeless, right? And they want help, and they don't want to be there by any stretch of the imagination. And then you got some of the people that ended there for whatever bad situation they got into, and they need help and they want it, but someone's just got to reach out to them. And then we've got the other people who don't want any help. So my thing is that, do we have a level of homelessness? Can we go and look at, and we talked about meeting and talking to all these individual people, and I know Tom and Sergeant Peart are out there doing that. Do we have a sheet that's got this? His name is Joe, Joe Smith. He's approximately this age, if we have IDs on him. And then we rate this person on, you know what, if we can find them shelter, they're going to go in a heartbeat, and they're going to say, thank you for driving me. Right. And there's other people that we got to go back and talk to them 2 or 3 times and encourage them. And then we know the people, like Tommy says, that there's so many of them that they don't even know who they are or where they are. Right. I mean, they can't voluntarily make that help or get that help that they want. So that takes us to the next thing that we talked about, what happened with Reagan, and bold, drastic. So my thing and my challenge to each of you at your different levels, whether you're the police officer who has a relationship with police chiefs all across the state, because we said it's not a Brentwood problem, it's not a county problem, it's a state problem, and some of the rules are federally mandated. So my challenge is that, Tommy, at the next Police Chiefs Association meeting, when you're there with your other police chiefs, see how serious of a problem they have or how much they're willing to step up. And then let's pick a date when we're all going to go to the Capitol, and then we're all going to go to Washington, D.C. And if we had somebody from each police department, from each city, and Diane, you reached out to all your county supervisors across the country when you're in your meeting and say, look, do you have a homeless problem? Good. We have a date set to go to Sacramento on this date. Get somebody from your county office there. Right. And then we got people from the county and from the health department. And we need to get our assemblies on mayor and the mayors on board. And each of those people need to reach out to their counterparts. I'm like Tommy, I'm also a very passionate person. That reach out, and that's my challenge, to say, can we do that? Let's pick a date from 30 days from now or 60 days from now that we're going to the Capitol to say we need to make law changes. Because the problem is, like we know with the homeless, the people that want help, they're willing to take it. We can build the shelters and we can help them have transitional housing. And that's great. And that's what some of the people that you guys work on a daily basis, you do a great job. I applaud you. The other people, like I said, you got to go out and talk to them 2 or 3 times and encourage them and say, look, don't you want help? Don't you want to get better? And we'll get there with those people. But the other ones, we need to go to the Congress and to the Senate and say, change the law, get it back the way it was prior. So these people, we can then, and we hate to say it, but actually force them into health because they can't help themselves. And I think that's the point that has to realize it. We're compassionate. I'm a compassionate guy. I go to church every Sunday and I try to be a good guy. But at some point, like Diane said too, there are family members that are so frustrated. I've been in that situation. You can only help your brother or your cousin or your uncle so many times. But when they're stealing from you or they're doing this or doing that, at some point you say, you can't come here anymore. I'm changing a lock on a door. And that's how people become homeless. And those people, once they get to the point of no return, we got to be able to say sorry, and we don't want to put them in jail. That doesn't do any good, right?
And
So
it's
that
much more expensive to put someone in jail or to put them in the hospital than to keep them housed.
Great, thank you, Greg. Phil, Phil Arnold, I'm going to unmute you. Go ahead, Phil.
All right, thank you very much. And I want to commend everyone for coming together to, again, talk it out. When my kids were young, when they had a problem and they got themselves hurt or in a situation, I would encourage them to cry it out. And if you have children, you know what I mean by that. Sometimes it's better just to be able to cry it out and get what's on the table so they can move forward. 𝗠𝗿𝗵𝗵, last time I saw you, I think your girls have they gone off to college? But time goes by so fast, and congratulations. And Chief Hansen, thank you for just being where you are at this point in time. My remarks will be brief, and I'll start it by saying that the problem is trying to answer the question, what vegetable does vegetable soup taste like? And if you can tell me that, I'd like to appreciate it, because for one person, it may taste like this. Another person, it may taste like something else. And we have a number of different things, but we say and know that one size does not fit all. Chief Hansen has said that there's multiple issues that are facing each and every person that him and his team encounters each and every day. It's circumstance versus choice. Some choose to remain homeless because there's less pressure other than just being where they are and watching their back from time to time. My church, the Bay Church, has had a mobile shower unit for the last 3 years. And my wife and I have worked on that in Martinez, Pittsburgh, and most recently at Bay Point. And those that we encounter come to us, and after they've come 3 or 4 weeks in a row, they begin to trust us. And we ask them, what can we pray for you? And that trust and their conversation opens the door on determining whether or not, is this person have a mental illness? We're not qualified to say yes or no, but are they speaking in a normal pattern, normal range is what's on their mind? And we want to convey to them, if there's one message we want to convey to them, is that you are not alone. You are not alone. And I thank CORE for that, because they have been part of us in Martinez when they've come to the shower trailer. And we've discovered that we need to provide pet shampoo, dog shampoo at the trailers, because a lot of times for the homeless, the only living creature that gives them unconditional love is their dog. So we want to treat their dog as well, if not better, than we treat them, so they can learn to trust us. But I thank you, CORE, for your work. I put an earlier comment in there about the children. And when the city of Pittsburgh had its warm winter nights, where they set up the tents inside of the church and allowed families to stay in tents inside the church. And in the daytime, we would pull our mobile shower trailer up and they would come out and take a shower. They brought their children with them. And there's nothing more engaging than talking to a child that's in the 6th or 7th grade, asking them how they're doing. And they're saying, I'm going to be doing great because I'm about to get a shower. How are you doing in school? I'm doing great. I was the #1 in this. I was the #1 in that. And we have a compounded problem with the pandemic when we've had such isolation. And I don't want to bring up a really low spot, but we had a child that took his own life a couple of weeks ago. And when an 11-year-old does that, we've got to, and I say we, I'm in the community, and Chief Hansen knows about it. That is a call to action, and that is a call to cooperate. We're on the same team, and the same team is how do we solve, how do we fix, how do we make sure that we are prepared to engage with each and every person. And first of all, listen to see what they have to say so that we know how to respond to them. But I commend you all for coming to back. This is a great launch pad this evening for this town hall to have a substantive discussion, a meaningful discussion, to air whatever different perspectives that we have so that we can come together on one accord. Again, I thank you all so very much, and I appreciate you.
Thanks, Phil.
Thank you, Phil.
Nice to hear your voice.
Cynthiana Todor. Go ahead, Cynthiana.
Hello, good evening, everyone. Thank you for the opportunity to ask a few questions. I put them in Q&A. I wasn't sure if we'll get to them, but I would like to get some answers tonight. Let me just start with saying I really appreciate everything that every single one of you does to try to solve this problem. Sounds like we don't have a solution right now, but as Rod mentioned, I don't see a common ground on what we need to do to solve this problem. So hopefully during future town halls, we would have a clear vision where we are, where we want to go, how do we get where we need to get with this big problem. So my questions are as follows. It sounds like there's a lot of funding out there, all types of services, facilities, and so on. It was presented at the beginning of the meeting. My question to you is, why is this homeless problem getting worse year over year instead of getting better? My second question is, and I think it was addressed by Mr. Hansen, is that state funding usually is a one-time deal. And I read this in some other sources. How do we fund services and shelters in the long run? We already pay taxes, and California has some of the highest taxes. So where is this money going? Where is the accountability? How do we manage it? And why are we not seeing results when we put billions of dollars to try to solve this issue? Also, I would like to know if we have any studies or data that can be shared tonight to show that building shelters or any facilities for homeless help reduce the homeless numbers. And my last question, our police needs legal tools to be able to bring the mentally ill to where they can get help. Is our county supervisor working with DA's office or even Sacramento legislators to pass any laws, create any policies to assist providing legal environment to support our police in order to enforce and help our homeless population? So those are my questions. They're also in writing on the Q&A section. So I really appreciate your time and attention to this very important matter. Thank you.
Well, I'm going to say, Cynthiana, you are a very well-spoken and a very active person. I follow you. And so I think you'd be great to help us when we go to Sacramento. I wrote down the questions and I didn't write it all out. So I'm going to start backward. You asked, is the supervisor working with the DA on tools? I wasn't really clear. I'm going to read that question in the Q&A. LaVonna, I don't know if there's any studies that talk about building shelters and reducing homelessness with shelters. But I will say that one of the challenges that we do have with state funding and one-time funding is, you're absolutely right. Sometimes we'll get a chunk of money for something to do something, but then there's no funding to keep the programs going. And so when we are looking at, applying for those grants or getting those money, we have to consider that. And that's one of the challenges that we have. And that's why I think even LaVonna was talking about, letting cities, have chunks of the beds that are in the shelters and helping fund that, because that helps us keep it going. But And I'm going to look up the rest of the questions. Do you guys want to answer some of her questions? And I'm sorry, I wrote why worst, and I can't remember what the rest of the question was.
Sure. If I can maybe jump in around the data question, and I do think it's important that everyone on this town hall today understands that we do collect good, robust data, and that we look at that to make informed decisions about what's working and what doesn't work. What we know, and this is demonstrated across the country, that shelters and transitional housing don't solve homelessness because those are temporary solutions. What solves homelessness is permanent housing. And that is what we are consistently trying to build. Housing that is permanent, that is affordable. And we're not talking about affordable as on a teacher salary or retail. We definitely need those individuals who are working retail, things of that nature. Those individuals absolutely need affordable housing. But when we talk about affordable housing, we're talking about individuals who might be living on a $996 Social Security check per month. And that's all. So extremely low income housing is really important and it's critical, and we have to build that. So shelter, you're 100% correct. It's not the solution. We already know that. And in working in this, it is something that is temporary to move people off the streets, right? Out of impacting, economic, development, things of that nature, moving people inside so they can get the help they need so that we can help them find the permanent housing, which takes a long time, permanent housing that they can afford. So I really want to be clear, it doesn't solve it. What it also doesn't solve is, at the end of the day, if we built enough housing, permanent housing for every single person on the street, that won't necessarily change the other complicating issues and factors, right? So, those individuals who are self-medicating, those individuals who are severely mentally ill, those things will not necessarily be contained in four walls. And so it is something that we have to work collaboratively to do. I also just want to make the point that it is something that, as homeless system providers, we struggle with daily to figure out how we pull the funding necessary to make the systems and develop the systems and services and safety net that we have and that we need. Some of that we've been really successful at, others not so much, trying to bring in more prevention dollars. One of the things that recently happened, which is supporting the back end of that permanent housing, is that Measure X, the voters voted for Measure X dollars. We have allocation of $12 million to help build that affordable housing and to close those gaps. That's something that we are excited to see that will be coming in the next year and beyond, the next 20 years, to help us build, but it's not here yet. And the last thing is that when we talk about advocacy, and I want to just share what I speak of probably weekly to my counterparts at the state, is that we cannot continue to get funding through multiple doors. It is hard and difficult when dollars come down through the public defender's office for homeless and housing services, then it comes to the continuum of care, and then it comes to health systems, and then it comes to PDs. It is difficult. Probation. It is difficult to pull all of those resources together and figure out how to use them and leverage them. I think Contra Costa does it probably as well as anyone does, and it is still very difficult. So that's one of the things that I most certainly in my day-to-day conversations are doing with our legislators, with our advocates at the state, who are all asking us the question, how do we make it better, right? And so those are the things that I want to mention. And the last thing, the data, there was a data question, and I'm going to drop into the chat We don't have data that we can pull for you right now, but we fully believe in transparency. And so I want to, I'll drop in the chat a link that you can email to Health, Housing, and Homeless Services to our data team. And our data team can pull that data for you and send it. So I'll drop that in the chat for the data question that came up.
Great, thank you. So I'm still working on some of the questions that are in the Q&A, and I'll continue to answer those. I don't have any other hands raised, so if there's anyone that has a question, one more question we'll take, and then we'll go. Oh, hang on one second, Melissa. Melissa, go ahead and ask your question.
Hi there. I actually, I also have a couple of different questions. Aside from the obvious problem of unhoused peoples who are suffering from addiction, oops, sorry, my radio. Aside from the folks who are suffering from addiction and from some extreme mental health crises, what, outside of that, I know when I moved to Brentwood back in 2015, there was required zoning for an emergency homeless shelter. I know, Captain Herbert, you said there hasn't been any additional discussion about now that the problem seems to have gotten bigger. Why hasn't there been any more discussion about building that shelter? Since, we have it zoned, in theory, the land is ready, and now it's become a bigger problem. And then beyond that, for the people who truly have just met unfortunate circumstances and have lost their home, whether they were evicted or their home was taken back by the bank, or whatever the circumstance was. Obviously, it's been a difficult few years for some people. What can Brentwood do to get more affordable housing built for the people who live in this area, instead of trying to kick them down the road to whatever next area is considered the unfortunate low income area for them? How can we bring them back into their own community? Many of whom maybe grew up in this community, many of whom maybe have children. I know a few years ago, there was a big to-do about Goodwill wanting to have a training center here in town, and that got shot down. So for everybody who is saying, how can we help? How can we help? What, instead of just sitting back and complaining because you don't want to look at this problem, you just want to push it down the road to the next town. What are some ways? What else can we do? Thank you.
Ma'am, I'll take that question. Back in 15, we had to designate a homeless shelter for some, I believe it was some financial paperwork. As if you look back, the community came out to council to really pretty much protest that, but it wasn't that we were going forward with that. It was just merely designating that. So there's never been a push from our community, and I'll take on the responsibility for that, because we can go back to what Supervisor Burgis said. We talked about that HEAP fund that was going to Homeless Emergency Assistance Program. And at that time, the supervisor was concerned about people losing their homes due to financial issues and crisis. And I was steadfast on that. Our homeless population was what I said earlier, was addicted to drugs. And at that time, Supervisor, you and I had some pretty robust conversations about that. And ma'am, I will tell you that I have not been a fan of a homeless shelter in our city until, and I'll go back to that. And you can call me wrong, but I believe I'm not wrong. I believe I know my homeless population. Until those other prongs that I talked about earlier, I cannot support that. However, I care about my people, and you could say, no, you're talking out of both sides of your mouth. I am not. I am not going to set up a homeless shelter in Brentwood because it's not going to fix the problem. And a lot of the a lot of the frustration is directed at me, and that's fine, directed at me. The county is very limited, but I put a lot of this onus on the state of California and how they disperse this money out there, and with a lack of a good well thought out long-term plan. So anybody that calls in and says, oh, we're kicking the can down the road, I'm not kicking the can down the road. I'm trying to give my council the best information that I have, that I think is best for this city, and from talking to my community. Any of you that know me know I'm not afraid to go out there and talk to my community. And if I knew that worked, if I knew a shelter worked and could be healthy for my community, I would support it. There's also legislation that was introduced last year that I think will be reintroduced, where the state's going to mandate cities and counties to provide rent subsidies or homeless shelters. It's 1437, I believe, Assembly Bill 1437. Call me if I'm wrong on that, and I'll give you the right one. And when if that comes to become law, and cities and counties are made to do this per the law, then I will get my community together. I will get my council together. And my council is very concerned on this. They hear it just like I do every day. So I would like to say, hey, if it does become law, we will go forward and we will do this. And if that's what the legislators in Sacramento think is the best answer for this, that cities provide homeless shelters, rent subsidies, and mental health, then it falls on us, and I will get input from my community and come up with a plan that best fits the city of Brentwood. But you could blame me for not supporting that. And again, Supervisor Burgis, thank you for your work on that. You and I don't agree with that, but we understand each other's points, I believe.
Okay, I'm going to take one more question from Jennifer, and then we'll wrap up this meeting with some closing statements, and then we will call it a night. So Jennifer, go ahead and unmute.
Hi, good evening, everybody. Jen Qualick here. I am local. I live in Palm Beach downtown, so very familiar with the sergeant, who has answered several phone calls from folks who have unfortunately made their way down our driveway and so on and so forth. But one comment I would like to say after viewing all of the chat comments, for those that are not familiar with our county staff, they are remarkable. And they do not see what goes on behind the scenes and the meetings and the countless hours and everything that they partake in. So in full transparency, I also myself work for the county, different district, but fabulous team, and certainly their hearts are in the right place. That being said, what I'm curious about locally, since clearly those of us who are on here tonight are interested in this topic, and I'll probably want to kick myself for even asking, is there a task force or locally something that we as a community and myself as a private citizen could volunteer to be on to help support you, Chief and Supervisor and LaVonna, Christy, that could meet more regularly to either gather information from you guys to then relay to those folks who, you know, pump out information on Nextdoor, Facebook, so on and so forth, or be more a part of some of these things. And whether that be going to Sacramento, I'm thrilled that we will soon have a new assembly person, absolutely thrilled in that. So would like to be part of the solution. It does make me nervous. I don't walk my dog anymore at night because we have had some not so nice encounters, because our home does back up to that portion of the Marsh Creek Trail there and the railroad tracks, which, as you know, the encampment is right there. And I see that absolutely beautiful pup. It's a little bit frightening after dark, so not gonna lie. But in any event, I'm happy to offer my support, volunteer what I can do, and maybe a task force or something is a starting point. I don't know, but thank you all again for coming tonight. I'm sure everybody's ready to go home and call it a day, so thank you again.
Great, thank you. All right, we'll start with Supervisor Burgess. Any closing statements or closing you'd like to say?
You know, I didn't really know what to expect from tonight. And so, you know, we kind of tried to bring what we thought we would need. And, you know, I knew that, you know, Chief Hansen and I both actually want the same thing. And I love that we can work together. And that's the beautiful thing, is what you don't always have to agree. You can just have the same goals and figure out how to work together. And so I feel encouraged. I'm glad that there was quite a few people attending and participating tonight, because I think even if one, you know, of the answers, like we can't, you know, just force people to do certain things. If that just that one thing is understood by a few more people, I think, you know, we've accomplished something. And you know, the thing is, I'll say that there is a you know, there's a regional effort to reduce homelessness, and there's, you know, kind of a plan. Well, there is a plan, and it's taking temporary housing, trying to create solid housing, and then having prevention. And that's kind of the beginning of a plan. And Contra Costa is one of the counties that are the recipients of working on this plan, and its goal to reduce. LaVonna, what is the goal? It's so bold. Christy, what is it?
75% of unsheltered homelessness that we are going to that. That's 1,200 individuals in Contra Costa.
3 years. That's the goal. And it's very bold. But what they're saying is that if we have housing, a really affordable housing that provides the services, and we have the temporary beds, and we have the preventive services. And I've also advocated that we also have to have the services for people once they get housed, to keep them housed. And that's not necessarily a part of that plan, but those three things: keeping people housed, having temporary housing, and it's a 1, 2, 4. I forget what it is. One
for every interim housing or shelter that you build, you need 2 permanent housing units, and you need 4 prevention opportunities. So you stop inflow, you slow down that inflow while you are continuing to support the outflow into permanency.
And so, yeah, and so there is philanthropy money. We've got, there's a lot of people that are involved in this, and it's a bold goal, but you know, I'm in it and I'm working on it, and I've got these ladies helping, and we've got a lot of, and I invite, you know, Chief Hansen to come to these meetings. We'll send you, you know, the information. I want to ask the tough questions. I want to be successful in what we're doing. And so I just wanted, you know, there was a question earlier about, well, you're talking about, but there's no plan. You know, maybe if we take this plan and we go to the state and we say, here, we've got an idea. This is a bunch of smart people from business, philanthropy, cities, elected officials, and we all think this is the way to go. Pay for it here. Let's prove that it can work. Maybe that's what we can start with. So I did want to let you know that we are not just talking about it, but we are trying to create these bold goals with a plan.
Great, thank you. LaVonna?
So I think I want to echo a little bit of what Supervisor Burgis says, and just acknowledge that this is a tough topic for any community. It is something that we most certainly at the county are always happy to come into community, in partnership with the community, and have these conversations. We are really clear. We know what we need. We absolutely do. But the way to get there is very different, right? So it's not just one approach. It's not just building housing. It's multi-pronged. We need policies that and legislation that support individuals getting treatment, and you know, whether that's mental health treatment or substance use disorder treatment. We need rental subsidies. We need affordable housing. We need a multitude of things, but we do know how to get there. We need the state and we need the federal government to also support us. The question that was asked around town hall or an ad hoc committee, if the city of Brentwood decides that, please know that the county will be there with you, just as we are participating fully in the city of Antioch homeless at council, as well as the city of Richmond, as well as Concord. We are participating full partnership. So if the city decides to do that, please let us know. We would love to make sure that we're there at the table.
Great, thank you. Christy?
Of course, I start coughing right when you call on me. I wanted to tell everyone that I put the All Home Regional Action Plan in the chat. And I will say the supervisor is not tooting her own horn, but Contra, Costa, and the Board of Supervisors, we are the first county to adopt that regional action plan. And that is a bold move. And it is now part of my job, what's one of my top priorities that 𝗠𝗏𝗵 has put on my plate to make that a reality. And that's a county plan. And Brentwood is a part of that county. And that is my commitment to help all of us come along with that. And my other commitment, and 𝗠𝗏𝗵 just highlighted it, that if the city of Brentwood is interested in creating an ad hoc committee of having a strategic plan of how to end homelessness or make it brief and non-reoccurring, whatever it is, we will be there at the table. I just joined the steering committee for the city of Richmond and their strategic plan. So all that to say is that we're here, we're in it with you, we're not walking away, and we're going to do it arm in arm and shoulder to shoulder. That is, again, that is our commitment. It's not a platitude. It is not me just kind of talking off the cuff. This is the real me. And as you all get to know me, you'll know that I stand by my word, and I'm committed to the city of Brentwood. I'm committed to our partnership with the PD to really tackle this issue. And if anyone ever has any questions, I'm happy to answer those. I'm happy to get on the phone. I'm happy to have those robust conversations, because that to me is what is going to move us forward. That to me is what is going to create the innovation that we all need to create those solutions for the city of Brentwood. It's not what's happening in the city of Richmond. What is it the city of Brentwood needs? And I'm here for it. And that is my commitment to all of you. And I really look forward to it. And I hope we continue with the town hall meetings, because it's been an invigorating conversation for me.
Great, thank you. Chief Hansen.
Really quick, I just want to say thank you so much. And if it came across as we're all not rowing in the right direction, that's not the case. We are, and we all want the same thing. So I apologize if I came across as we're not, because that's not the case. Someone had asked earlier how we got here. Again, I'll go back to some legislation that has been passed, and I say it's anti-victim legislation. So we have a lot of laws that have been passed over the last 10 years that have put some of our communities in some real areas that were pushed up against the wall that I think have contributed to homelessness. I won't go into that right now. I want people to know that tonight was an opener. We were asked to come here, and I didn't know what to expect either, but I know that I had given some direction to my sergeant to come here and educate our community on some of their frustration and some of the limitations that we are up against. And if it didn't look like I come across as we're working together, we work together. We rely on the county and their resources that they provide. Our core team that comes out and is in daily conversation with our sergeant who's out there. One of our council members, Councilmember Meyer, went out the other night on the pit count, and she got to see that and interact with one of your core members who I got tremendous feedback on, who was just a wealth of knowledge on this very complex social issue that we continue to deal with. So if people are showing up tonight thinking we had all the answers, this was the wrong meeting, because I don't have the answers, but I'm willing to step up and put our ideas together. And one caller had called in and said we have to be all on the same page, and he's exactly right. We have to agree to some extent. We won't always agree, but we know what the bottom line is, and that's helping our people that are struggling right now in our society. And more than ever, I see it as the police chief. And I want more than anything for those folks to get well, for those families that are suffering from that. Can you imagine going to bed every night knowing a loved one is out there facing some of these challenges? Believe me, when it's raining and it's cold at night, I think of my population that's out there. But I think it takes bold moves. It's going to take some bold legislation and getting the right people in the room. So thank you, everyone. I'm available if we want to continue offline to my community that called in. Please reach out to me. But you know, your council sets direction, so they are very willing and they want to hear from our community on this issue and all the issues facing the city of Brentwood. So thank you, everything. I want to thank Captain Herbert for getting this together.
Thank you, Chief. I also wanted to let everyone know I provided Sergeant Peart's email address in the chat, and he is our homeless liaison, and he's always more than willing to reach out to our citizens who have concerns. And again, as expressed earlier in the evening, we are all frustrated with the, it appears, lack of action when it comes to the homeless encampments, and Sergeant Peart will be more than happy to explain to you why something may have happened one way or another. So again, I provided his email in the chat for you. Again, I want to thank our panel members for being here tonight. And this is the first of many to come. And yes, we all need to put our heads together to find a solution that works for everyone and works for the citizens of Brentwood. Again, thank you. And this will conclude our town hall for tonight. Have a good evening.
Everybody be safe.
Thanks, everyone.
Right.